Grant Blaschke here from familydoctor.expert. Today I'm going to talk about a serious topic, advanced care planning. So I'm sure many of us could think of many things we'd like to talk about more than how we might die and what sort of medical care we would want should we lose our capacity to make our own decisions. However, we live in a time of history where medical technology is so advanced that we can keep many of our failing organs and health systems going for a long time in a hospital setting. And we have a medical workforce that's been very much brought up on curing and treating and doing, and sometimes struggles to let things take their natural course. So I wanted to make viewers of familydoctor.expert aware of an important process where you can fill out a form called an Advanced Care Directive. And this is actually a form that I've filled out with lots of my patients recently. And what it does is it lays out in writing your preferences if you were to lose your capacity to make decisions in terms of healthcare, in terms of how long you would want your life prolonged, in terms of what would be acceptable and unacceptable if you were severely ill with a life-threatening illness. So the goal is to really put your voice as the patient central to any decision making, to ensure dignity and to avoid suffering, and frankly, to not keep people living beyond a state that they would want. And this is a very sensitive and nuanced sort of decision and pretty confronting, and most of us don't really want to think about it or talk about it. But I'm going to tell you why I think it's a good idea and how you could go about it. So it's a good idea because if it came to that situation where you didn't have an ability to contribute to your own medical decision making, family and doctors will be much better placed to know what you would want. So how do you go about achieving this? You can go along to your GP or to your hospital and say that you want to complete an advanced care directive. There are different legislation and requirements around the states of Australia and territory, but they more or less say the same thing. Think about who you would want to appoint as a substitute decision maker. Who would you trust to make a good decision if you're in this situation where you couldn't make your own decisions? Now, the Advanced Care Directive can be just a letter that you compose and write, but I recommend using the templates, and most hospitals and certainly state health departments have a good template form for you to fill out. And you'll be asked to comment on the following sorts of subjects: what matters to you and what living well means to you. And I think this reflects the fact that there's such a wide variation about what people define as quality of life. And I've seen this as a GP. For some people, being able to get up and just sit around and watch television for the day, they're happy. That's all they want to do. For other people, living well means a high level of engagement and socializing and all sorts of things. So there's no rules about it. It's what matters to you and what living well means to you. Importantly, the form will ask about what are unacceptable circumstances for you, just to give you a sense of the sorts of things. And again, there's no rules, but you might say, if I couldn't recognize my family, I wouldn't want the doctors to continue treating me. If I couldn't communicate with family, if I was permanently bent-bound and needed others for feeding or toileting me, that would be unacceptable to me. Again, no rules, and I've seen a wide spectrum of what people actually want. The other thing you'll be asked to comment on is to what extent you want life-prolonging treatments, what sort of health outcomes you want. So do you want treatment to be prolonged as long as possible? Or do you only want it to be prolonged until the outcome is clear? And if that outcome really was against what you would consider and have stated are unacceptable circumstances, then you want the doctors to not continue with intensive treatments. Or even at the lower end, you only want pain and symptom management, but just to let things take the natural course. So these are the sort of things that you can express in an advanced care directive. Another sort of question that's very useful is whether or not you would want what doctors call CPR, cardiopulmonary resuscitation. And you can say, yes, if medically appropriate, I would want to be resuscitated, or no, I'd prefer to be allowed to have a natural death. If you were nearing death, would you want to be in the hospital? Would you prefer to be managed at home? And there's some fantastic palliative care services which I've used, which have made home dying very comfortable and special for the family. But again, there's no rules. Some people feel more comfortable in a hospital, and that's okay. You'll also be asked if you're supportive of organ and tissue donation, and this could be very relevant. There's lots of people on waiting lists for organ donation, so that's something you could think about. Be aware there's also a special form in most states called refusal of medical treatment, and you can appoint a medical agent or guardian if there's a particular treatment that you really don't want, and there are a whole lot of legal protections and safeguards around that. So this letter or form needs to be signed by 2 witnesses. One of the witnesses has to be someone that could complete a statutory declaration. Then you get copies of this form. Make sure your GP's got it on his record or her record. Make sure the hospital's got it. Make sure your family's got it. For those of you who have already signed up to the electronic e-health record, you can upload your form there, which is a good way to make sure that everyone knows what your wishes are. It's worthwhile reviewing the form, particularly if your health status changes, or if you get hospitalised for a severe illness, or if you go into palliative care. So it's an important discussion and a sensitive one, but I think most worthwhile. So book to see your GP and have a talk about advanced care planning. As usual, these family doctor expert videos are just for general advice. Don't make any decisions just based on this video. Have a chat to your regular doctor. Wish you all the best from familydoctor.expert.